Hello, my dear colleagues. Today I want to share my opinion about a series of webinars dedicated to the very important topic in rehabilitation of edentulous patients. I'm talking about the all-on-4 concept. The series is presented by the author of this philosophy of treatment, Dr. Paulo Malo, and his talented team. First of all, what makes this course so unique? That it is presented by the author of this philosophy. And in the first lecture, Dr. Paulo Malo, being a genius doctor, a very interesting guy, ambidextrous genius surgeon, he shows you the evolution of the all-on-4 concept, how he came up with the idea of creating this concept, what was the need of creating this kind of treatment approach, how it's all started with immediate loading in the beginning of 90s of the 20th century, how they started to use this approach in lower jaw first, then they started to use this approach in upper jaw, and how they faced the need to create their own implants, their own design, because those implants that were used by that time, the Branamax system, was not very useful in the design of the implant itself. So he shows you the evolution, how the system was evolving. On one slide, he, for 15 minutes, talks about this very important detail, what was the rationale of creating of that system. So the thread design, the implant apex design, the design of the connection, the sizes, diameter, the length of the implants, their position, the level of their tilting, inclination, and how to make also the regularization of the ridge, how to create a very nice bone platform for the future prosthetic work for achieving very good result. And I think that what we have to understand, that all-on-4 concept is not just tilting of implants and that's it, and it's 4 implants. No, all-on-4 concept is a concept of treatment where you can achieve immediate loading and can use the treatment modalities without bone augmentation, and it uses the tilting of the implants as a treatment approach. It also estimates that 4 implants are more than enough for the rehabilitation of the edentulous jaw, whether it's maxillar or mandible. Also, it utilizes the concept of the choice of the implant design and implant diameter, implant length, and the reduction of the ridge to avoid aesthetic problems and to hide this transition line from the artificial gingiva to the natural gingiva of the patient. And also, it utilizes special instruments like Malo guide for placing of implants and special methods for achieving immediate loading, so very nice stable primary stability no matter with what kind of bone you work and what kind of anatomical situation there is. So Dr. Malo step by step describes to you the surgical approach, the surgical part of the treatment, because all-on-4, the way it was created by Dr. Malo, is a prosthodontic concept with surgical means, with surgical steps. And first 2 lectures are dedicated to the surgery. They're dedicated to the way the procedure is done. And what I was impressed by when I visited Dr. Malo's clinic, that everything is protocol is systemized. I mean, that it's systemic approach from indications, what kind of anesthesia, what kind of incision, the length of the incision, the position of the incision, the instruments for the incision, how to open the flap, how to stabilize the flap, how to make the preparation of the implant bed, how to achieve primary stability, how to use the protocol of the insufficient preparation, incomplete preparation of the bone, where the implants have to be, how to achieve predictable result. And then Andreia Rodrigues and Pedro Sobreira are very talented doctors that work with Dr. Malo. They discuss the prosthodontic steps, how to create temporary prosthesis immediately. There are 3 ways how to make the temporary on implants in all-on-4 concepts. One of them is when the prosthesis is already done by the technician and you need to realign the temporary abutments after the implant placement. One of them when it's a sort of mixture, when the prosthesis is already produced, but you use it for aligning, but you also give it to the dental technician for finishing. And also the next step, when there is no prosthesis that are made before the surgery, but you can make the impression, make the bite registration, and have very fast and effective way of producing the prosthesis at the same day of surgery. And also the final prosthetics, options for the final prosthetics, the titanium bar with acrylic teeth, the titanium bar with composite, the titanium bar with ceramic teeth, so-called metal ceramic or ceramic prosthesis on implants. Also, they discuss step by step what you have to do before the surgery, what kind of decisions you have to make, how to do the preparation before the surgery for being able to deliver as fast as possible the temporary prosthetics to provide this immediate loading, how to avoid mistakes, how to deal with problems that could arise during the healing period, and how to deal with problems that could arise after the final prosthetics, the design, special consideration, diagnostics, what should we do, how should we do, what tools to use, what components to use, and how to achieve predictable results. And we will see it from the prosthodontist standpoint and from the dental technician's standpoint. So it's a complete course, and you can have an idea about how to select, how to find the indications and proper patient selections if this patient has indication for all-on-4 concept, or we can use conventional concept, for example all-on-6, and place implants vertically parallel to each other. So if you make the decision that it is all-on-4 concept, is it a conventional all-on-4? Because Dr. Malo also shows the extreme cases where he utilized combination of the dental implants with zygoma implants or using only zygoma implants. So how to make these decisions? When and what could we do? How we prepare for the surgery? What kind of diagnostic steps we have to do? What kind of information we need to gather before we send patient to the operating room? And what should we do during the surgery? The anesthesia, the procedure itself, how to create implant stability, where to place implants, what implants to choose, and how to provide stable result and temporary prosthetic result that the patient who will come to the clinic in the morning will leave the clinic in the evening with a fixed teeth in his mouth, and how to provide very reliable results in final prosthetics. And this all is presented in these very useful lectures. I personally, practicing all-on-4 for 10 years right now, found a lot of useful information in this course, even besides having listened to Paulo Malo many years before. So I think you will find it useful too. Thank you. Well, I hope that this series of lectures will help you to start practicing all-on-4 following the correct protocol. And those of you who already started practicing all-on-4, you managed to get some answers if something went wrong before, how to avoid having mistakes, and how to be able to achieve predictable results. And I wish to you great results and grateful patients. Goodbye.